So this video is for those who are going to appear in the NEET counseling, and if you are looking for DNB Orthopaedics, if you are searching videos regarding DNB Orthopaedics, what is important for you, what if you don't get MS Orthopaedics, then this video is for you. Before you take DNB Orthopaedics, must remember that when you are going to appear in the final examination, you are going to appear in the toughest examination of your life. So let me tell you, DNB Orthopaedics is way more difficult than any other examination that you will ever encounter. You know why I'm telling this? Because I'm a third year resident and I just appeared in the examination, and believe me or not, those 4 days when you're going to appear in your theory examination is going to be the toughest 4 days of your life. This year we got a lot of ectopic questions. Ectopic questions are those that according to you comes from the other department. Like we had external beam radiation therapy question, brachytherapy question, ACLS, BCLS. While we were giving our examination, one thing I noticed, the examination was not about talent. The examination was not about you knowing the subject. The examination was to know who can finish the examination. It was so lengthy that it was like a race. People were trying to write everything regardless. There was no time you can recall anything. It was a race to finish the examination. There is no syllabus, there is no pattern, and you don't know what type of questions you will encounter in all those 4 examinations. If the results are going to be same like previous year, then I guess it is going to be less than 10% people passing this examination. I always say, and I will always say this to every junior, that take DNB Orthopaedics only if you are passionate about orthopedics. So those appearing in NEET counseling, NEET PG counseling, if you are taking DNB Orthopaedics just because you are not getting MS Orthopaedics and you don't like orthopedic much, just because of the peer pressure or family pressure you are taking DNB Orthopaedics, believe me, don't take it. Go for any other branch, but don't take DNB Orthopaedics. Don't take any hospital just because you are getting DNB Orthopaedics. Believe me, not every hospital gives you that much of strength to pass the examination. Not every hospital gives you that much of training. You have to study by your own. Choosing a bad hospital is going to be a torture for you throughout your residency. So choose your hospital wisely. Go ask manager, ask residents, ask OT staff, ask GDA staff who are working there, and ask them about the environment, about the toxicity in the department, and about the patient load and what type of patients that hospital usually get. It is equivalent to MS, that is for sure. Yes, DNB is equivalent to MS, and you are going to get the same salary, probably more, in corporate sector than from a MS candidate. But to clear the examination is a challenge. The final point from my side, a third year resident, is don't take DNB Orthopaedics just because you are not getting MS Orthopaedics. Don't take DNB Orthopaedics just because of peer pressure or family pressure. Take DNB Orthopaedics if you're not getting MS Orthopaedics and you're passionate about orthopedics.